We sound okay?
How do I sound? Cool. Great.
Hi, I'm Dr. Manish Gupta. I'm here at Juniors, and we're here to talk about being healthy and staying active. I'm actually an orthopedic surgeon, not just on TV here or the radio, but do practice it, and a sports medicine specialist. So I specialize in joints and their recovery and how to make people active, especially when they get hurt. And I happened to find a friend, Michael Rose here, who's celebrating his 50th birthday. So, yay, Mike, 50th birthday.
Trying to keep
everybody,
that quiet.
you know,
Thank you.
cheers. And Mike, you don't look a day over 35 years old.
I feel like I'm 38.
Oh, really? 38.
38.
I'm just kidding about 35, but you know,
But
40 will
38
work.
38 works, right?
Right, right. So, Mike, I know for a fact that chasing all those young ladies that you do.
No.
How do you like to stay active? And is it important to you?
Oh, for me, being active, as I turn 39 coming up, I stay active in part because I like to look fit. So I stay active with CrossFit. I stay active with daily activities of surfing, stand-up paddleboarding.
So when you're surfing out there, I mean, you use all your muscles, your joints, and you want them to work properly, I would assume, right? Are there things you do when you get hurt or to prevent injury?
You know, I have more injuries with CrossFit than I do with surfing as a whole. But for me, I have tennis elbow on both of my elbows, and I have a spur on my shoulder.
You know, it's funny. You're not the first person who's told me that CrossFit actually injures you.
Yeah.
You know, these people do it all the time to stay in shape, but I get a lot of business from the CrossFit community. And I got to tell you, and my counseling for the CrossFitters is that, when they come to me and they complain of shoulder pain, hip pain, knee pain, we get an x-ray and all that. But I really go down and we look at their biomechanics. We want to make sure that they're using those joints properly. And we use physical therapy, a lot of non-operative techniques. And I got to tell you that even for a lot of these, tennis elbow you mentioned and these tendon injuries that you mentioned, I, in my practice, use stem cell. We use state-of-the-art, non-operative techniques. We use ultrasound to guide stem cell treatments to the injured tendons. Would you be interested in something like that?
I've never heard of stem cells being used for tennis elbow or shoulders.
Well, it's actually something that's coming into the sports medicine community. We look at where you have the injury. Is it a rotator cuff? Is it your medial epicondyle tendon? Or that's what you need for doing playing tennis and other repetitive movements. And we found that when a tendon degenerates, it's like we need to regenerate it. Yes. And it's part of regenerative medicine where stem cells are now becoming a biological treatment that's guided towards healing the tendon, rejuvenating it like you do with Botox in the skin in South Florida.
I mean, that sounds like a common sense fix to a problem that I have.
Because
Yes.
surgery is not always the answer, you would agree?
My theory is if I can stay away from surgery, all the better. I have knee pain on my left knee that I try and protect as much as I can, just because I don't want that surgical side of things.
So now let's say if you were going to need surgery, how would you go about choosing a doctor who would do surgery on you? Just a question out there.
For me, it's usually word of mouth, but I also spend some time looking at their websites.
Websites. And what do you look for in the website? Is it have to be informative? I mean, what grabs you in a website when you think about it?
With my background, what I look for is someone that is more on the cutting edge of technology, but yet not out there. It's still common sense science. Like your stem cells.
Yeah, it's funny because, when you say that, one of the things I love about my job as being an orthopedic surgeon is really to educate the community. I used to live here. I grew up here. As a matter of fact, there was Club Boca, just, used to be a regular, but not anymore.
Oh, sure.
But, and it was really about, when I came back to practice, it was about educating my community and saying, if you're injured, this is the information you need to know. And you have a compassionate doctor and surgeon who is up to speed on the latest technology, but at the same time will treat you like a homegrown, a person who's looking for that compassionate care.
Yes, and that's why a combination of word of mouth for me as a friend. I said, I went and saw this doctor. He was awesome. I felt like he really cared about what my pains were, but I also want someone who's more technically advanced.
It's funny because having said that, my practice, I try to educate my patients on the latest technology that's out there. For example, we're doing a lot of robotics in our practice now, especially with knee replacements and partial knee replacements. And a lot of my patients don't even know what a partial knee replacement is. Do you know what that means?
I've heard of total knee replacement, but a partial knee replacement is they do half a knee.
Kind of like that, because the knee is made up of 3 compartments, and we look at where you have the most wear. So using the robotic technology to map out and be almost perfect, we're able to just replace part of the knee that's worn out. So it's like instead of 4 tires being changed in your car, we only change the tire that needs to be changed. So it's a faster recovery. It's allows you to have a more cosmetic and smaller incision, and that really helps. I've found my patients get back to being active a lot faster.
Is this one where the robot does the case?
No, because it would be. Then I would be back in the the old days.
That's what I want.
And I'll be obsolete. I can't let that happen.
Okay.
It's to me the robotics is a tool. It helps me to be more precise. Okay. It helps for things to be more accurate. But just the other day, when the robot wasn't working as functional, when I was doing one of my surgeries, I had to rely on what my training in the 15 years I've spent in school and working with other surgeons and my fellowship at Johns Hopkins and Union Memorial Hospital, taking care of like the top athletes in the world. I used to be a Ravens doctor, and the robot didn't function as properly. I had to rely on all those
experiences.
And you have to, because again, it's a tool. It's a tool that makes you better, not necessarily that can replace you. In my feeling. So, have you ever been injured, Michael, or?
I have yet to be surgery. I do have, again, as I said, I'm 50 years old. I have the traditional rotator cuff, keeping me from sleeping through the night, and then I have my left knee.
And so far, have you seen a doctor about it? Have you seen a specialist like myself?
I'm not a big supporter of. But you are probably different, but I am not a big supporter of orthopedic or doctors in general.
Well, let me give you this brochure, Michael. Open and read it. It's right there. Call the office, 561-314-7200. And the practice has other orthopedic surgeons. But, it may be something that may be beneficial to you, because we'll take you from a non-operative, not going to cut right away. We're going to use injections, possibly therapy, and modalities that are going to help you recover, and maybe you don't even need surgery. But if you do, you've got a trusted hand.
For me,
look at my hands; they don't shake. See,
I can do that. Shake. You can do that.
There was a guy who stood on his hands for 3.2 miles.
No way.
I can't do that, but I can operate.
But you can operate.
I can operate very well. Yeah.
So I can't do 3.2 miles or operate.
But you can surf.
But I can surf. In my own mind, I'm really good.
Really? Yeah. Have you done the tube waving and everything?
No.
What do they call that?
They don't have
Taking
tubes.
The wave?
They don't have tubes down in South Florida.
Where do you go for that?
I would probably be Costa Rica.
Costa Rica. Is that your favorite place you like to surf?
In my own mind, yes.
Got it. I've tried surfing.
How'd you do?
I was more on my back than I was on the surfboard. But, it gave me a lot of good exercise.
It does. It does. A lot of good exercise. That. It's really good. But you mentioned something that I haven't done surgery, but when I was in CrossFit, I blew out my tennis elbow. And instead of fixing it, I just stopped exercising for 8 weeks.
And that's something that I don't recommend.
And well, I did put on some weight right here, although it doesn't look like it on camera. The camera does add 5 pounds, just so you know.
That's a myth, Mike.
Is it?
Yeah.
No, it's 5 pounds.
Is it 5 pounds?
Right, 5 pounds in your belly.
Got it.
But so, yes, I think knowing now about the stem cells and what you've done with placement of those stem cells, that might be something that instead of taking 8 weeks off.
You know, actually, I was a very competitive tennis player in the state of Florida when I was growing up, and I never developed tennis elbow at that time. But it's when I started operating, and I was not exercising as much, I developed tennis elbow. And the way I treated my tennis elbow was through stem cell injections.
Really?
And I had to get a couple of them, but they worked remarkably. And I had used steroid injections, I did all those things. But all steroids they actually caused that tendon to degenerate even more. And with the stem cell, I was able to regenerate that tendon. It acted like a pain modality, and the tendon was healthier, and we could see that through ultrasound that my tendon had recovered. So it's something that I know personally has worked to help, not just myself, but a lot of my patients go back to.
Is the stem cell something like my father's doing injections for his knees? It's a hyaluronic acid.
That's a different type of injection. What that is a lubricating injection. I sort of call it the oil change in the car.
Yep, he goes in every
3 months or 4 months, and you do that. But it is one of those modalities that helps us to relieve pain and get you going.
So that wouldn't work for my dad.
Well, the stem cell would work for your dad if it's something that, one of the things about stem cell is that it is a little bit cost prohibitive. It is costly. It's not covered by insurance, but we do find that there is a lot of benefit to it.
Really?
And, in our office, we were able to do a good payment plan, and people come in and they're able to get relief. And it can put off their surgery, or sometimes in some cases, I haven't even seen some of my patients back who've got the lipogems, the FDA-approved version of the mesenchymal cells that we use to inject in the knees, the hips, the shoulders, to treat patients who have arthritis, who don't want surgery right away, and who want another option.
So on your sports side, what is the most common injury you see down here?
Well, I take care of FAU. I've been their team doctor for about 6 years now, and having said that, I cover a lot of high schools and their injuries. And the most common thing I see is either knee or ankle. Okay. And knee and ankle sprains. I've done ACL reconstructions. Everybody's familiar with that. All the football players now either have had an ACL or are going to have an ACL. We reconstruct those and we get them back in the game. It do take some time to recover. So in our practice, we have our own therapists and all the people that are needed to get that player back, whether it's a massage therapist, whether it's our trainers or our physical therapists, and then obviously our surgeons that help us. So the other injury that I see a lot is ankles, and a lot of people get ankle sprains and they wonder and they say, I don't need physical therapy, but one of the reasons why I encourage people to get physical therapy for the ankles is because of re-injury. Sometimes we have to go through a regimen of proprioceptive and strengthening exercises so that the ankle doesn't get re-injured again.
I have a friend who's a big mountain biker in Duluth, Minnesota, and he hurt his ankle 15 years ago. And he's been fighting getting it fixed for 15 years now. And he just stepped up to the plate, and they went in and did a small incision and removed a piece of bone, and then did some injections.
A lot of times you have to go in and tighten the capsule and the ligaments, and you have to reconstruct the ankle. I specifically don't operate on the ankle all the time. There are some specific things I do, but I have some specialists in my practice that help me, take care of those specific needs. I consider myself more of a shoulder, hip, and knee surgeon, and also a non-operative orthopedic surgeon as well. One of the things that I always get is that, well, you must be an orthopedic surgeon, you just operate a lot. I got to tell you, 80% of my practice is non-operative orthopedics.
Really?
Because, not everybody needs surgery. Surgery should be something that should be considered when it's the last thing and when conservative care has been maximized. Or in some cases, if you're in a motorcycle accident and your femur's hanging out,
Right.
you need surgery.
Right.
There, we don't contemplate that you need non-operative care,
Don't say that because I do have a motorcycle, so
You
just
got to be careful with that.
I know.
What kind of bike do you have?
I have an old Triumph I rebuilt.
Triumph. One of my favorite bikes.
It's just beautiful. Cafe racer. I don't wear a helmet, so hopefully you won't see me with the femur fracture.
Yeah. I encourage you to wear your helmet
No.
because we take care of a lot of concussions and as well, and that can injure not just your head but your shoulder, hips, and knees. So.
Everything down the road.
Yeah, it's the circuitry, right?
Right.
The circuitry of the brain is very much important to take care of the other joints.
So you had me possibly when you said you don't believe in doing surgery on everyone, because I'm one of those guys that I will fight before I ever do a surgery.
Well, that's why you have all these different
Yes.
treatment options that you got to consider. And to be a successful surgeon, you have to be a person that needs to pick the right people that are going to benefit from surgery.
What makes you different than the other 200 orthopedic reps here in South Florida, if I can ask?
Orthopedic surgeons? Well, first of all, I don't think there's too many of them that have been in this area for as long as I have, that know the community as well as I do, and that have kind of come back to take care of their community. I mean, just a few months ago, I operated on my trigonometry teacher. She walked in, and there I was. We did a hip on her.
Did you really?
Right? Yeah, and my principal from middle school.
Oh my, that would be my dream.
Get back at your principal. For all
oh my
those
God,
detentions.
for all my detentions. Like, remember when you gave me detention and I didn't deserve it?
I get to actually close the cycle up.
Yeah.
They helped me get to where I was, and I can take care of them. So I think that's unique. I have a good feeling for what people in South Florida want.
Yeah.
They want to be active. The cosmetics is important to them. They want to look good. They want to feel good.
Yep.
So, and a lot of times they don't want to be, operated on all the time. So we have a very comprehensive non-operative program. And then when we do consider surgery, we use minimal incisions. We use robotics. We use whatever we can to be cosmetically pleasing to our patients. So I think that makes me unique as a sports and reconstructive orthopedic surgeon in the community.
Well, if I need my knee fixed, I'll be certain to give you a call. Hopefully I'll be 60 by then.
One last question. What did you do for your 50th birthday?
Well, I had my parents just moved nearby, so they were in town. My sisters flew down to help them unpack, and I went to the Blue Martini on Saturday night, and we danced I stayed up till 2 in the morning, and my parents, who are now 85, danced till 1 in the morning.
Wow. Were you sore the next day?
I don't remember. No comment.
Well, I'm glad you were active on your 50th birthday,
Yes.
and I wish you many more. And hopefully we'll be doing this interview when you're 75.
I hope to be, yes, with no more surgeries.
Pleasure meeting you, Mike.
Thank you so much.
All right, take care.